So the first person I would like to introduce to you is Sharon Rudderham, who is a Mi'kmaq woman from the First Nation community of Member 2 right here in Unama'ki. Sharon is currently the health administrator of the Eskasoni Community Health Center and health director, or is it full health director? Yeah, which is located about 45 minutes from here. She's currently the administrator for all community health programs from home care, diabetes education, early intervention, Head Start and mental health services, as well as primary care and physician services for a community of 4,300 people. Today, Sharon has also been instrumental in the coordination and development of a collaborative network, the Dwegan Partnership, amongst 5 Cape Breton Mi'kmaq communities and the establishment of relations and negotiations between local district health authorities around health services for Mi'kmaq communities. And that is no easy feat. This woman has moved mountains and moved bureaucracy like I have never seen moved before in innovative ways that I can only imagine what she went through. And she'll talk to you more about some of the work that she's done. But really, the fortitude you've shown in these discussions is incredible. In the past, Sharon has also completed a term as the Mi'kmaq co-chair of the Mi'kmaq Nova Scotia Federal Tripartite Forum Health Committee, and she continues to participate in many local, provincial, and national committees on First Nations health. Welcome, Sharon. And Daphne Hutt-MacLeod, who's right beside me, is a graduate of the Mount St. Vincent University School Psychology program and is a registered psychologist. She's worked on behalf of First Nations communities in Unama'ki for 27 years as a school psychologist, clinical therapist, director of health, interim chief executive officer, interim director of operations, and is currently the director of mental health in Eskasoni First Nation. Her areas of community involvement have included a broad and varied range of programs and services, from health literacy initiatives, such as bringing the Dolly Parton Imagination Library program to Unama'ki communities, to capital facility acquisitions, including new health centers and youth health centers, to co-creating First Nations parenting programs, cultural awareness models, First Nations crisis intervention guidelines, and a unique First Nations case management and community mental health addictions model of service delivery. Most recently, she has been engaged in research initiatives to guide and shape community health and mental health planning. And in her spare time, which is very little, she serves on a number of boards and committees, including here at Cape Breton University on our Board of Governors, and is a Girl Guide Rangers leader. So as you can see, the two of them separately are incredibly dynamic and have done a lot. But together, you can only imagine what they have been able to accomplish and what they continue to accomplish today. So on that, we are going to start talking about the journey and the Eskasoni story. So, Sharon, because we've been mentioning Eskasoni and not a lot of people in the room or the live stream are familiar with it, can you tell us about Eskasoni and explain sort of the community to us?
Sure. Eskasoni, I work in Eskasoni, and I've worked in Eskasoni probably the last 15 years, I'd say. I've been working in Eskasoni. And those of you that don't know our communities, well, you're getting to know our communities a little bit more. We're all connected. We all have relatives in the various communities throughout Cape Breton and beyond. The community of Eskasoni is located here on beautiful Cape Breton Island, located next to the Bredor Lakes. And as Ashley and others have said, the population is about 4,300, and it's a growing population. 50% of our population right now is under the age of 25, which is completely opposite to the general Nova Scotia population demographic, where Nova Scotia's population is an aging population consisting of a lot of baby boomers. And our First Nations community is the largest First Nations community east of Quebec. So, as Mi'kmaq people, we believe that we are a collective. Our community is connected through teachings, and these teachings have been passed down for thousands of years. And all of our initiatives that we provide within our community are focused on the Mi'kmaq belief of a shared responsibility for each other and to Mother Earth. So today we're going to talk about, you've learned about the residential schools, but we also are going to, we'll share a little bit about the impacts of colonization and residential schools. It has resulted in profound impacts in our community and resulting in serious health and addictions issues. I also wanted to share that I am a child of a residential school survivor as well. that I should be adding to my bio. But I think tonight we're going to talk about how our community, one community, through a long history of tragedy, and how we're going to look, how we've turned that around into a story, we hope, of inspiration for other First Nations communities.
That's great. Okay, so Herbie and I are going to try the first video. Did you want to set up the video, or do you want to explain it after? How would you like to?
We'll talk about it after. Yes.
Okay,
Although
ready?
I do think it's important to talk about, just set the stage for the fact that these videos that you're going to see tonight came about because of a discussion in an airport, I believe. And it really demonstrates how human relations and one dot can connect to another dot that you wouldn't normally expect. Ashley happened to meet up with a young lady in an airport who wanted to do a documentary or her film practicum in a First Nations community. And she went, I have the perfect people and the perfect community. And tonight's resulting 3 videos, I'm sure at the end you'll agree with me. They're absolutely stunning. They worked beautifully for us. She captured everything that we wanted captured. And so we did her a service, but she did us a greater service by being able to take our story and put it into a video.